Good day. I am Jane Wayan, nursing student from Southwestern University, and for today's video, I will be going to assess my patient's neurovascular assessment, which is the upper and lower extremities of my patients. But first thing we should do the hand hygiene, which is the most important thing to do before you assess your patient. Ready to go to assess my patient. Good day, Miss. I am Jane Wayan, your nursing student for today, and I will be going to assess your neurovascular assessment, which is I'm going to check your upper and your lower extremities. And now we should start. Okay, the first thing I do to assess my patient's neurovascular test would be the inspection. The first and foremost is the inspection. But the first thing to do is we should start by her upper extremities, which is in this area, the upper area of her body. We should check if there's any redness or any swelling in the area or any pain you can feel. And now would be we would assess the capillary refill, which is I'm going to pinch his nail bud, and how many seconds it will return back. Okay, 2 seconds, and that is just normal. Next would be the skin turgor. Okay, just the same. And now check the biceps or any redness or any swelling from the upper extremities, the bilateral movement of her arms. If there's anything you can feel, any arthritis or any pain. Not at all. Assess also her hand deformities, but her hands is just normal, just fine, same level. And now for the muscle strength, it would be you will squeeze my hand. Okay, that is really good. And now you will move me from the upper hand. Okay, and now we'll check her drift hold. Just raise your hand and close your eyes if there is any drift that's happening in her arms, and not at all. So okay, your upper extremities is just fine and just normal. And now we'll be going to assess her lower extremities, which she will be lying on the bed, and I will check her lower extremities from her knees down to her feet. Next would be the assessment of her lower extremities, which is from her knees down to her feet. And now we will first inspect normal hair growth, abnormal, any swelling or any pain you can feel, but just normal. And now palpate her pulse, which is behind the knee. Which I could feel it, and it's just normal. Push tibia to check if there is any edema. And there's none. And also check if there's any fungus or ingrown from her feet. Just a normal teenager nail bud from her in her feet. Okay, now down to her feet. in palpating or inspecting patient's feet, we should use Dunn gloves, but I don't have it right now, so I'm just using my hands. But the first thing I do is do the hand hygiene before inspecting and palpating my patient's feet. Okay, now we'll check her feet if there is any redness or swollen area or any pain she can feel, and also palpate the pulses of the feet. Just normal for the pulses of the feet, and also the posterior tibial to pulse really good. And now we should also do the capillary, for which is I'm going to pinch hair nail bud and nose when it's returned back. Okay, just normal. And now what my patient is going to do is she will be going to push my hands. Push my hands. Okay, and now resist my hands from her feet. Okay, go. Last would be the inspecting of any Babinski reflex, any signs or symptoms of the Babinski reflex, which is I'm going to use any instruments, but I just use my hands right now for the improvise, which is I'm going to tingle her feet and just negative normal effect. Okay. Okay. And just normal. And that would be the neurovascular assessment for the upper and lower extremities. Now, miss, you can now sit back and relax. Okay? That would be all for the neurovascular assessment. Thank you for your participation, miss.
You're welcome.
And the last thing would be do is the hand hygiene. And that would be all. Thank you.